For over 50 years, BouldreCentre for Orthopedics and Spine has been serving patients in Boulder, Broomfield, and the entire Front Range. As the region's most preferred orthopedic practice, they offer the latest in joint replacement and revision techniques in their state-of-the-art facilities. We recently took a trip to their Boulder location. Take a look. So I'm here at BouldreCentre for Orthopedics and Spine with Dr. Blackwood. Wonderful to be here with you, doctor. And you've just recently completed your 5,000th Makoplasty surgery. What is this procedure and who is this for?
That's a great question. So the Mako robotic arm assisted surgery is for hip and knee replacements. So when patients who've had osteoarthritis or had wear and tear in their joints, it can be for partial knee replacements, total knee replacements, or total hip replacements.
So doctor, we're here in Boulder, but you also have an office and a surgery center in Broomfield. Tell us about these locations.
So while I mainly have my clinic here in Boulder, we do have a new building in Broomfield, close to I-25, that will allow us to see patients there, have physical therapy there, and then perform surgery there. We have an ambulatory surgery center, so we're able to do a lot of the joint replacement patients out there and have them go home the same day from that new surgery center out there.
And with so many successful surgeries that you've accomplished, what does this mean to you as a doctor, and what does it also mean for your patients?
I think for me as a doctor, it just lets me know that we've been able to help that many people and help them get back to their mobility in their lives and get out of pain that they've had for chronic joint pain. For the patients themselves, hopefully they're able to do that. And they can trust the experience that we have for that. So 5,000 is a big number. We do quite a few of these surgeries every week. And to be able to get to that number over more than a decade allows them to be comfortable with what we're doing and that they can expect the best care that we can provide.
Now, let's talk about how you've seen joint replacement surgeries really change over the last 15 years.
Yeah, it's definitely changed quite a bit from when I got here and from when we started, 13, 14 years ago. We see much more robotic influence, much more technology, a lot more shorter hospital stays. So patients are leaving the same day of surgery, they're leaving the next day after surgery. We're also trying to work on decreasing the amount of narcotics they're taking. So I used to be able to send like 100 pills for oxycodone for patients, which has unfortunately helped create this sort of epidemic that we had. And so now we're actually trying to get less than 10 pills for patients to take after surgery. So we're decreasing the pain, decreasing the swelling, and hopefully making it an easier procedure to get through.
Can you go into a little bit more detail about the typical recovery after a knee replacement or a joint replacement surgery? What does that look like?
So once you have your surgery, you're able to leave the facility. Before you leave, you should be able to get in and out of bed on your own, go to the bathroom on your own, do stairs if you need to. And then when you get home, the first night's usually not too bad. They have a block in there for about 24 to 36 hours, which helps with some of the pain. Unfortunately, that block wears off, and then we start to get some pain for those first few days. That's where we're trying to reduce the swelling and sort of attack the pain with a multimodal pain regimen. And so that first week's not very fun. But once you get through that, then we want you to get up and move around, and usually the recovery starts to improve from there.
And you've also been honored by 5280 magazine. You've been recognized as a top doctor. What do you hope that these personal milestones that you've achieved will help bring to the study of orthopedics in general?
I'm hoping that there's a little bit of personal ego that comes from being able to have these awards or being recognized that way. It's flattering, it's humbling to know that other people think of you that way. It's voted on by your peers, and so that we're able to try to raise the bar and do as well as we can with our surgeries. And hopefully that then expands out that our whole practice, this is a quality practice with specialists, and people can come to BouldreCentre for Orthopedics and Spine and expect to get top level care that they could get anywhere else in the country.
Great. Thank you so much, doctor.
Thank you.
To learn more about Dr. Blackwood and his specialties, visit BouldreCentre.com. That's also where you can find details about the orthopedic care services provided, like Mako Smart Robotics technology, MRI scans, orthobiologic injections, and more. They paid for this segment. Stay with us.